I'm going to.
All righty, we're going to get started about 2 minutes early today because the senator is on a very tight schedule and needs to be out of here to go over to Fox News, I believe, after this.
Yeah.
Good morning to everyone. I'm Matt James, Senior Vice President at the Henry J. Kaiser Family Foundation. I'm pinch hitting here today for my boss, Drew Altman. Drew is recovering from the flu, which he insists way too much is of the non-swine variety, but he thought it best to avoid airplanes, being the head of a health organization, to avoid airplanes and not infect important senators or the D.C. press corps. I'd like to welcome you to what I think is our fifth family's NFIB, Kaiser, Newsmaker breakfast on health reform. Today we have Senator Orrin Hatch, whom we're delighted to have with us. Senator Hatch is an important player in the current health reform debate, and we're looking forward to his comments. Senator Drew usually opens with a little health policy fact of the week, and then he turns it over to Dan and to Ron for the more traditional introductions. But as he was preparing for his remarks this time, he became fascinated with another part of your biography, which may be a little bit less well known, but that is your career as a songwriter. So we're going to dispense with the health policy fact of the week today for Drew's in-depth analysis of the heretofore unexamined link between Senator Hatch's songwriting and health reform.
I wouldn't call it a career, however.
If you look at it, it's actually very clear. For example, his song Everything and More was obviously an unconscious appeal for universal coverage, though undoubtedly through market mechanisms. The band he managed, Free Agency, is no doubt what introduced him to the market approach in the first place. And his song Heal Our Land is an obvious appeal for bipartisan politics in Washington, which is something we always need.
And major health care. We want to heal everybody.
Absolutely. You know. And also to have had Frank Zappa compose a song about you, which the senator did, is certainly more than anyone else in the involved in health care reform debate can claim. But here to actually talk about health reform is Ron Pollock. He's going to say a few words in introduction, and then we'll turn it over to Dan for what I'm sure will be a much more conventional introduction here.
Let me just introduce you to one other song, because it would apply very much here. It's entitled, Are You Lonely Here With Me?
Well, following Matt's theme here, I thought with Dan's blessing, who's going to give the real introduction, I would talk a little bit about the senator's prowess as a musician. I don't think I did as well with the senator during Tuesday's roundtable on using Medicaid to help low-income folks get coverage. But
you gave the usual shibboleth.
But I thought at least I could regale folks with a story that you probably haven't heard, but it follows from Matt's introduction. Almost 2 years ago, we did a major event. Families USA was trying to build support for the Children's Health Insurance Program, which Senator Hatch was obviously the leading proponent of. And on this particular occasion, I invited my college classmate, the singer and musical artist Paul Simon, to join us in this event. Paul actually has a real history of working on children's health issues. He was the co-founder of the Children's Health Fund, and he's a major funder for it. So we had this event in the Capitol. Some of you attended that event. And Senator Hatch was the most significant speaker. We had others, the Speaker of the House and Senate Majority Leader Reid. After the event was over, Senator Hatch and Paul went over to the senator's office, and they spent, by my estimate, about an hour and a half together going over the senator's music. And after they were finished, I took Paul out to lunch, and I said, well, Paul, what'd you think of the senator's music? And Paul said, and this in the privacy, so he didn't have to flatter the senator, he said, he's actually pretty good. He's got some real talent. I know that probably makes you feel as good as any of the...
Well, if only he'd sing my stuff.
Well, first we're glad that you didn't change your daytime job, but I have to say, Senator, I'm actually going to go back to Paul and ask him to compose a song about using Medicaid for covering low-income families, and I hope he can entice you to do a duet.
I think I could write that song, and I might teach you a little bit about the deficiencies of Medicaid and Medicare. But we're going to work with you, don't worry.
Well, thank you. It's my very great pleasure to introduce the fifth speaker in our series this morning. Senator Hatch is certainly no stranger to health care. As indicated earlier, he serves on both the Finance and Health Committees. He has a long history dealing with health care as the architect and longtime supporter of the Children's Health Insurance Program, as co-author of legislation that significantly increased the availability of low-cost generic drugs. He's also no stranger to how to get things done, which is one of the reasons we're so delighted that he's interested in this issue, and he's here this morning to talk to all of you and all of us about how to get something done. So thank you so much for being here, Senator.
Well, thank you so much, and it's a privilege to be with all of you. I've got prepared remarks, and then I hope we have enough time for some questions before we're going to have to leave for network TV. But it's just an opportunity to be with you today. I'm very grateful to be able to talk about health care reform. Specifically, I want to talk about the need for health care reform, the principles that should guide it, and the value of bipartisan efforts. And I hope that everyone in this room recognizes that we have a real need for reform. We have a crisis in this country in health care, and an opportunity on behalf of the American people to get it done. An opportunity like we haven't had before. I think that if we're responsible and we strive for true bipartisanship, we can get meaningful reform done this year. Now, before talking about policy, let me talk a little bit about process. Healthcare reform is an important national priority that is too big for political gamesmanship. We are talking about an issue that makes up 1/6 of our American economy. Any successful healthcare reform proposal must be subject to the full scrutiny of both parties of the Senate and House of Representatives and the American people. Using the budget reconciliation process in the Senate, for example, would limit debate to only 20 hours and restrict senators' abilities to amend and perfect a proposal that is intended to steer 1/6 of the economy of our nation in a new direction. Now, this would make it difficult, if not impossible, to gain broad bipartisan support for the effort. It would be, in my opinion, a tremendous disservice to the American people and to our nation. Plus, the majority side is quickly realizing that accomplishing the complex task of health care reform through the technical maze of the reconciliation process is very difficult. Let me now focus on policy. At the outset, it's always a good idea to identify the problems that we need to solve. Clearly, health care spending continues to grow too fast. This year will mark the biggest, largest ever one-year jump in health care share of our GDP. This is a full percentage point to 17.6%. Now, you can think of this as a horse race between costs and the resources to cover those costs. The sad reality is that costs win year after year. Growing health care costs translate directly into higher coverage costs. In the past decade, the cost of health coverage has increased 120%, 3 times the growth of inflation and 4 times the growth of wages. It is not the only problem, but cost is a major reason why more than 45 million people do not have health insurance. Now, I believe we need to do more to ensure that we achieve universal access to affordable and quality and to the degree that we can, portable health care for every American. That's the bottom line. We spend too much, we cover too few, and we don't get our money's worth, and it's time for reform. And the American people are worried that we're going to place government, or should I say bureaucrats, between themselves and their doctors. It's a major concern. Reform is about more than drafting legislation. It's about steering 1/6 of the American economy, or the U.S. economy, in a new direction to deliver better results for American families. I personally believe that a few principles, simple principles, can serve as a useful roadmap for the direction that we should go. The first principle is that reform must control the burden of rising health care costs, including entitlement costs. Health care has to be affordable for the individual, the family, business, and taxpayers. and there simply cannot be any reform that does not first and foremost address the fundamental issue of cost containment. If you skip that step, any coverage reforms will ultimately unravel under the burden of higher costs. Now, this has been my biggest concern with the Massachusetts model. Coverage took such a central focus in that reform model that cost containment was not thoroughly addressed, and now we are seeing rising problems in the state of Massachusetts. This group is sophisticated enough to understand that there is no single silver bullet that will control costs. Instead, we'll need to address the issue broadly and comprehensively. For example, healthcare reform should include meaningful medical liability reform because wasteful defensive medicine costs our nation up to $178 billion each year in additional costs, according to most observers. Actually, I think it's much higher than that as a former medical liability defense lawyer. A lot of cases are frivolous cases brought just to get the defense costs, which range between $50,000 and $200,000 on the average cases. And you can make a lot of money as an attorney if you just get the defense costs. And what insurance company wouldn't pay the defense costs rather than risk going to a runaway jury? Well, we need ideas like physician safe harbors, specialized health courts, and sanctions for filing repeated frivolous predatory lawsuits. That's hard to do. The list could go on, but the point is simple. The first priority must be comprehensive efforts to control costs. Now, the second principle is that reform should provide a solid path toward access to quality, affordable, and portable coverage for every American. The uninsured are a varied lot. About a quarter are eligible for public programs like Medicaid or S-CHIP, but are not enrolled. They qualify, but they're not enrolled. And we need to reach out and find them and get them enrolled. And many are either students or relatively affluent, but simply choose to go without coverage. As we move forward to achieve affordable access for every American, we need to ensure that we build on the employer-based system. Now, this system provides quality coverage to more than 177 million Americans. Similarly, we have to ensure that we do not make it even more difficult for small businesses to survive and thrive in these incredibly tough times. Now, as we move toward comprehensive reform, it is important to recognize that every state has its own unique mix of demographics, and each state has developed its own institutions to address its challenges, and each has its own successes. There is an enormous reservoir of expertise, experience, and field-tested reform. We should take advantage of that by placing states at the center of efforts tailored to meet coverage and affordability goals, so that we can use approaches that best reflect their unique needs and demographics. I think everybody can agree that Utah and Massachusetts, that Utah is not Massachusetts, and Massachusetts is not Utah. Some people in Massachusetts think that's a good idea. We in Utah know it's a good idea. There will be an important role for the federal government, but it will have to give the states flexibility and financial assistance to meet coverage and affordability objectives. There's no reason why we should not take care of everybody in our society. Everybody should have health care. Now, we must not make the mistake of assuming that the federal government is the solution to all problems, however. The focus should be on our families, not on Washington. We're all worried about placing bureaucrats in the middle of this equation between patients and doctors. And Washington not only tends to do that, Washington does do that. Special focus needs to be given to small businesses. They're the job-creating engine of our economy. As an ardent supporter of small business health plan legislation in the past, I want to assure that their unique needs are addressed. Everything from insurance market reforms to health insurance exchanges to small business tax credits should be considered to make coverage more affordable for them. Now, I have very strong concerns about creating a new government health care plan. This is nothing more than a backdoor approach to a single-payer system. The new public plan will allow the federal government to create an unlevel playing field by setting price controls, just like they do in Medicare and Medicaid, while shifting all costs to the private sector. Speaker Nancy Pelosi has already made it clear that the House version of health care reform legislation will contain a new government-run, or should I say Washington government-run public plan. According to a recent study, a new public plan would cause almost 120 million Americans to lose their private coverage. Now, this is almost 3 times the size of the entire Medicare program. I hope you got that point. Most important, families will actually see their premiums rise somewhere between $1,500 and $2,000 a year if we're lucky. And that's almost 1/2 of an average family's total grocery bill for the full year. Now, a third principle is that reform should transform the healthcare system to focus on value and quality. If we end up spending more, we should get our money's worth. It's as simple as that. Our system should continue to move toward paying for quality and coordinated outcomes. At every stage, we have the opportunity to use the Medicare payment system to reward value and quality rather than volume and overuse. Right now, we have seniors who are seeing 5 to 10 different physicians and taking between 15 and 20 medications, which often contradict each other. This is unacceptable, and it's wrong. The broken physician payment system, which calls for a 21% cut in payments this year, gives us the perfect opportunity to accomplish this. We must reform this broken system as a part of healthcare reform, or any healthcare reform. This is a crucial and powerful lever to transform the practice of medicine. And we should have a zero-tolerance policy toward Medicare fraud and abuse that is estimated at nearly 10% of total Medicare spending. By the way, Brent James, one of the leading economists, healthcare economists, in fact, the leading one in the country, happens to come from Utah. Almost everybody pays attention because of the good healthcare system in Utah. He indicates there may be as much as 50% waste in the whole process. Now, that's a serious situation. Waste, fraud, and abuse is something we have to do something about if we want to have health care really run in this country. Now, the best health care is health care that's not needed. The fourth principle is that the reform effort must focus on making prevention and wellness an integral part of not only our healthcare system, but our daily living. For example, several employers in the private sector, including Safeway and Pitney Bowes, are using financial incentives like reduced premiums and lower co-payments to encourage prevention and wellness behavior like weight loss and daily exercise. We should learn and build on these innovative approaches as we move forward to create a healthier nation. Now, the fifth principle is that our healthcare infrastructure and workforce should reflect the realities of the 21st century. We absolutely must have access to the finest tools and the best trained providers. Our doctors are the best in the world, but sometimes we don't let them really be the best in the world. Patients and providers need better treatments. We must have proper funding for NIH and CDC to ensure that America remains the world leader in research and medical breakthroughs that won't just treat diseases, but prevent and cure them. Special attention needs to be given to FDA modernization. I passed the FDA Modernization Act in 1992 to develop the White Oak Plaza, and frankly, it's taken us till just recently to really get that up and running, and it's only partially done now and won't be done probably until 2014 or 15, at a cost of about 6 times more than it would have cost had we done it right back then. Now, like I say, we have to modernize FDA and attract our nation's best and brightest to the agency that regulates 25% of all of our consumer goods, up to 25%. Let's understand something. That agency is very important, but it's very tough to attract the best scientists and physicians and PhDs to work for government at government rates when the private sector is willing to pay much more. But NIH doesn't have that problem quite as badly because it's a privilege to work at NIH, and even if you only work at NIH for a few years, you're going to walk out and make a lot more money later if money's your major concern. At FDA, we've had them deployed in something like over 30 different locations in the greater Washington area, not mentioning throughout the states, some of which are converted chicken coops. And to be honest with you, there isn't the incentive to work for FDA that there needs to be. When we get this complete, most modern set of facilities out at FDA, I think we'll overcome some of that. Finally, we have to create a workforce commission to provide recommendations to better coordinate the fragmented public-private efforts and provide us with comprehensive recommendations to eliminate workforce shortages. Now, the sixth principle is to provide our families and doctors with better and more useful information. Patients and providers should better understand their care and be confident of its efficacy. Clinical comparative effectiveness, if done right, can provide us with valuable information while protecting patient choice and medical innovation. The key is to focus on what works best for the individual patient, not what is simply the cheapest option. We should continue to build on and improve efforts like CMS's Hospital Compare initiative. The growth of private information and safety task forces at the point of care should also be encouraged. Now, the seventh principle, and possibly the most challenging, we must accomplish bipartisan entitlement reform. Social Security, Medicare, and Medicaid spending will account for 9.5% of GDP by 2010, 18% of GDP by 2030, and 28.5% of GDP by 2050. If we allow that to happen, this will crowd out spending for everything, including national defense and education. Now, those are my 7 broad principles for health care reform. Address costs first, ensure access to affordable and portable coverage for every American, move toward quality and value, promote prevention and wellness, modernize our health care infrastructure, empower patients and providers with better information, and finally address the entitlement reform challenges in a bipartisan manner. They sound simple, but they will work if we can get together and do it in a bipartisan way. The only way to effectively address this situation is by working together. Solidarity and resolve must replace partisanship and rhetoric to ensure that future generations have the same opportunities to prosper in this great nation as all of us have had. So with that, I just thought that would be kind of a broad general outline of some of the thoughts that I have on this. And why don't we just open it up for questions, your questions.
Senator is going to handle his own questions, and
I'll
please
start,
identify yourself.
I'll start right down. We'll start with you, then you, then you.
Senator Hatch, at the round table the other day, Karen Ignati from AHIP was talking about, as a potential alternative to a public plan, perhaps having a very stringent federal regulation of the insurance industry, perhaps similar to what there is in some of the European countries, the Netherlands, or even in the HBP. Is that something you think that might be grounds for a compromise on this obviously very thorny issue?
Well, it's a very thorny issue. We have a lot of regulations pertaining to the industry now. Look, the insurance industry is part of the problem here as well. Government's a big part of the problem. Entitlements are a big part of the problem. The insurance companies are a big part of the problem. You know, let's be honest about it. We give incentives to insurers to insure those who are well. And we penalize those who insure those who aren't well. Now, that system has to change. Now, to the extent that we can do reasonable regulation to be able to help bring about where there's more equity and more evenness in the system, perhaps that might be good. But, you know, that's easier said than done. And I'm not sure I want a bunch of people in Washington, D.C. Setting up a Washington health plan for everybody in America. I would prefer having 50 state laboratories, because I can tell you right now, Utah is head and shoulders above most other states in the Union. Rhode Island does some very good things. I just sat down with the senator from Rhode Island yesterday in Sheldon White House and had a very interesting discussion about their problems and their solutions up there. But you can't say that about every state in the Union, as you well know. And some of the larger states are disasters. We all know that. Now, that's where a lot of people come out and say, well, we need the federal government to come in and teach us how to do health care. I haven't seen the federal government do very well in teaching us how to do health care. So we have to look at this very carefully, and I would prefer to somehow or other give the states more flexibility and then watch what they do and then take the best of the states and then magnify and grow from there. Yes, I mean, these are by necessity short answers. I could go on for hours on that. Go ahead.
But the differences between the parties over this issue of a public plan is, I mean, the battle lines seem to be drawn over there. Is there a way to compromise? Is there a way to achieve bipartisanship and still compromise on this issue?
This business of public plan is kind of withering away. I was just with a number of Democrats yesterday. They said that isn't going to happen. Well, I don't know. I think there's a great desire to have Washington-run health care. Now, if we do that, I guarantee you the people in this country aren't going to put up with it. They're going to be very, very unhappy. And let's be honest. I believe the public plan has been used as a hammer to try and get a number of things that the left would like to get into our health care system. More government controls, more government-run, more Washington-run health care, more bureaucratic installments, which they don't think are bad. They think actually that would help the system. I don't. I don't see it. But you know, and naturally there's a natural tendency, as my good friend Tom Daschle, who wrote in his book, we need to have a public plan option. Well, if you do that, you're going to have a public plan setting of price controls. And if that happens, you're an already difficult private insurance sector will have even more difficulty being competitive. So, you know, my answer is not more government. My answer is to get all these states working on the best programs they can. A lot of people would benefit a lot if they just looked at Utah and just see what we do there. And one reason why we're as good as we are is because of Brent James and Intermountain Health Care. And I'm not trying to overdo that because every health care system in Utah, I think, would rise to pretty well near the top in our country today. Now, naturally, parochially, I love Utah, and I may be a little bit prejudiced, but most people will admit that we have a pretty good system out there compared to most other states.
Senator Hatch, you talked about...
Next, and then I'll just go around, okay? And she's next, then you, and then I'll come over again.
Senator Hatch, you...
Did you say fringes? I'm starting to worry about this just a week. Go ahead. No, okay. On the right, that well, then, of course.
You talked in your very opening remarks about the dangers of using reconciliation rules to get health care through. And I know that many leading Democrats say they hope not to do that, but it's obviously a tool that's being reserved. If Democrats used reconciliation rules to get health care passed, what would be the consequences?
Well, first of all, most of them don't understand the complexities of trying to use reconciliation on a major substantive piece of legislation that affects 1/6 of the American economy. If they want to really get into that, they're going to look like fools because it's a very, very difficult thing. Who knows how the parliamentarians will rule, but they've been gradually eroding reconciliation over the years. Now, I think it's being used more as a hammer, and there is a significant number of Democrats who really want to use reconciliation for a much more simple approach towards health care. And this will please you. They are trying to push more and more people into Medicaid and Medicare. And frankly, they're talking about 133% of the federal poverty level. Now think about it. Utah is spending at 74% of the federal poverty level. That would double our costs. And the states would go nuts if they try to do something like that. And frankly, well, let's take New York. New York is at 100% of the federal poverty level. But to go up another 33%, you know, would be very, very difficult for them. They can't handle the 100% now. And not only that, but I believe that what would happen is that if they do that, then they'll say, oh, well, we'll cover everything from the federal government standpoint. Once you do that, you've got Washington-run health care throughout the country, and we all know how efficient that's going to be. And I think instead of having 50 state laboratories where we can pick and choose among the best programs in the country, we'd be stuck with a Washington-run health care program with all the bureaucracy and all of the difficulties we have. Right now, on Medicaid down in Texas, But in certain areas of Texas, only 17% of the doctors will take those patients, Medicare patients, that is. I mean, that's a matter of great concern. And then, you know, they're talking about bundling and everything else. I've had doctors say, I'm through, I'm out. If they do that, I'm quitting. And as you all know, we have a primary care problem in this country, second to none. And we've got to find ways of incentivizing private care. We also need to do more. One thing that can work pretty well would be community health centers, but we've got to work on making those more effective. I could go on and on.
But if Democrats in the end if they used reconciliation, got a program they liked, wouldn't that some Democrats say, well, okay, we had to use this tool, but I wonder if there would be any downside.
Well, I guarantee you, if they use reconciliation, you won't have a program you like 5 years from now. I mean, it'll wreck the system. Now, they may do that, but I was with the chairman of the Finance Committee last night. He said, don't worry about it, we're not going to do that. I really think they've got to think that through. Reconciliation bill could make health care look like Swiss cheese with all kinds of holes in it. So, you know, it's maybe that's not the best metaphor, but I kind of like it. But it's probably more accurate than I even mean it. But you know, the partisan part of me says, oh, I hope they do that, because they'll have to live with every stinking problem that comes up over the next number of years, and there are going to be myriad problems that they never even contemplated. Take it from me, I've worked in the healthcare field basically all my professional life, and certainly as a senator, and have helped author everything from the orphan drug bill to Hatch-Waxman to CHIP to you name it. But I'm very concerned about it. But they can do it if they really want to. And there is a significant number of liberal Democrats who want to do that because they feel like some Republicans won't be cooperative in getting what they want to have done. You were next. I guess you were next, and then I'll go to you two. Okay, go ahead. I'll try to answer a little less.
You said that you've never seen the federal government kind of do anything. Nielsen Hobbs from the picture. Excuse me. You said the federal government's numbers were really sort of done a great. I'm sorry. You said the federal government's never done a great innovation in healthcare, but one thing that seems to be working well is the Medicare drug benefit. And I was wondering if you could talk a little bit about sort of what you could learn about.
Well, the Medicare drug benefit was working well. Yeah. I'm sorry.
Than a total reform package would be.
Well, I'm not saying the federal government has no role. I mean, let's face it, a lot of the money has to come from the federal government. But I am saying let's not let them set up the system or monitor and manage the system, because I've found that in almost every case you have plenty of deficiencies. Now, you can point to some good things, too, so I don't mean to just sound totally sour.
I wasn't trying to challenge you, I was trying to kind of just
No, I understand. No, I understand. There's a role for the federal government. That's pretty apparent, and one of the most important roles is to help with the money.
So how would a structure of a overall healthcare reform, how should it be different than the Medicare drug benefit that's been enacted?
Well, you can't do away with Medicare and Medicaid. I mean, they're functioning, important programs that the American people have come to rely on. On the other hand, do you want to expand them at the expense of a more effective people-run program? When there's a real question of whether there are the monies there. Plus the fact that you go to a public plan, there are about last time I heard there would be 120 million people who would lose their health insurance, and that would put some real problems on the whole country. I think I've got that right. About 120 million people.
That was a rough estimate.
It's a rough estimate. Well, like I say, you were next.
Yes, sir. Senator Craig Palmer, ADA News. Let's go to your 7 principles. I think we can see a rough prioritization, at least starting from the top. But let's look at it a different way. Where is your give? Everybody's going to have to give something here, and where are you able to give?
You'll have to watch and learn, because I'm not going to say what my give is. No, I'm not trying to be superficial here. I'm just saying that we're in the middle of negotiations. We're in the middle of trying to come up with this, and there naturally will have to be some gives. There's no question about it, because there are two sides to this, and well, there are many more than two sides, but two major sides, the left and the right, and it's very difficult to bring them together. So I'm not trying to avoid your question. I just think it's better for me to not get into that type of detail right now. Yes.
Thank you, Senator Hatch. You just mentioned that you favored the states to, be the source of innovation, yet at the same time to build on the employer-based system to provide health care. And, it seems a bit contradictory because the employer-based state, they rest on ERISA, which is a federal regulatory regime, and we have, over the last 2 years, ERISA preempting or in serious conflict with state reform innovation. In other words, ERISA is still in a position to block the state innovation. Would you favor working around ERISA, radically revising ERISA? And so what would the fate of ERISA be? And by the way, we have an open seat on the Supreme Court. And do you think that might become an issue in confirmation?
Well, you raise a very important point. Keep in mind, when I say I'd like 50 state laboratories working on this, this is going to be a federal program that hopefully will rely or give incentives to the states to be able, and some flexibility to be able to make these programs work. Having worked with ERISA for most of my Senate service, I have to tell you, it's a very, very difficult program to amend or to modify. And in many ways, it works. So that all has to be taken into consideration. This is a complex thing. If we can do overall health care reform, it's not going to be some itty-bitty one-size-fits-all approach to everything. We're going to have to, that's why it has to be bipartisan. But you can't ignore laws that are already on the books, and to the extent that they have to be modified, we shouldn't be afraid to do so. But that's a complex set of questions that you've raised there. That's not just one question. Yes, you're next. Yes, and I'll come back this way.
Go ahead. Senator Anna Edney with Congress Daily. You mentioned that the insurance industry needs reform, but you don't want to see Washington get more involved. So who does it, and what are you looking for exactly?
I didn't quite say I don't want Washington to be more involved. Washington's going to be involved. That's what we're talking about. But I'd like to see the states have more flexibility to help resolve the real questions that arise. Like I said in my prepared remarks, Utah is not Massachusetts. Neither is California, Massachusetts, or New York. And Texas is unlike any of them. Just to mention a few states of significance. They're all significant in this business, and that's the point. But we have different demographics, we have different needs, and some states actually operate a lot better than others. And I'd cite Utah as a good example of a state that really seems to be on top of things. And by the way, we're so efficient that we get a lot less reimbursement on a lot of things than other states, which is not very fair. I mean, we ought to be rewarding efficiency and cost savings and especially, above all, quality. And we don't do that. We tend to just throw money to the states that aren't doing the job or don't do it as well, we'll put it that way. So these are all matters of real concern to me, and they're not easy matters to resolve. Yes.
Senator, I'm sorry, I hate to make you go backwards, but can I follow up on that? Exactly what kind of state flexibility are you looking for? What exactly do we need to give the states in the way of flexibility? So
well, broadly speaking, I would hope that the states would be able to resolve their own internal problems of health care, because they are, like I say, there are different demographics. Some states have different, well, most states have different problems from other states. Small states have tremendously different problems from most of the large states. Some of the large states have almost insurmountable problems. And I'll cite New Jersey as an illustration. What?
Are you just talking about the insurance market here? Or
no, I'm talking about the overall health care reform. And see, it may be that one of the big functions of the federal government is to provide the necessary, at least additional funding that will help this system to go. Now, look, funding's a big problem, as I've been indicating in my remarks. We're spending approximately $2 trillion now on health care. If the president gets his way under his program, and it would be a Washington program, you're talking about $1 to $1.5 trillion more. And we're already talking over the next 10 years of a $9.3 trillion federal deficit on top of that. So, you know, if you look at that, we've got to find ways of getting the states to help us with efficiencies, with quality, with deliverability, with interoperability, and all of those things. And I think that can be done. Now, will some states mess it up? Yeah. But most states would take it very seriously. I think they all take it seriously, but most states would run a system a lot better than that would be run here in Washington. We'll put it that way, by a bunch of Washington bureaucrats who don't understand the respective problems of the states. So, you know, I don't want to get into the details because the federal government's certainly going to have a pretty huge role here. Is it time?
It's your time.
I'll let it go at that, and then I'll take one or two more. Yeah.
Doug Trapp, American Medical News. Is the Senate Help Committee making any progress when it
You what
comes
now?
to Medicare? Is the Senate Help Committee making any progress?
Well,
when
let me say this is one of the problems. You've got two major committees in the Senate, and only God knows what you have in the House. We'll put it that way. But and I'm not sure even he knows sometimes because of the nature of free will and thinking. But let me just say this. Senator Kennedy wants to move ahead with health care in the Help Committee, but I think it's pretty tough to fully do that because the money is in the Finance Committee. Now, help is very important, and I happen to sit on both committees. So we'll be working in both areas. And both committees are important because both committees, basically help handles the public health aspects and finance almost everything else. But that's where we are. And I think we've got to coordinate our work together. Now, I will say this, that both Senator Kennedy and Senator Baucus, Senator Enzi and Senator Grassley, they have been trying to work together. And I believe so far we've had a fairly good rapport. I'm going to just have to quit here, but we'll take...
doing anything on Medicare physician payment reform in the Help Committee? Are they doing their own solution, or is it just the Finance Committee?
Yeah, I think they want to come up with their own solution, and they may make it, and we may have something different in the Finance Committee. Keep in mind, both Enzi and I are on the Help Committee. Enzi's the ranking member on Help. I used to chair Help. I get along both. I'm going to have to let you be the last one because I hate to leave because frankly, I'd rather spend another hour with you.
Janet Adamy from the Wall Street Journal. Senator Grassley said yesterday in an interview with Iowa Radio that he was at the White House, and in a discussion with the president, he indicated that because of the threat of reconciliation, he said, and I'll just quote him, that it put him into the position of negotiating at the same time a Republican alternative. Is there a Republican alternative plan being negotiated? If that isn't happening already, do you anticipate that happening soon?
Well, Republicans are certainly working on alternatives as we speak, and my office has done extensive work on what we think ought to be done, mainly to assist everybody here. But, you know, I think, I hope we have a few more plans out there. I'll compliment Senator Wyden and Senator Bennett. You know, theirs is the only written plan that's out there. Now, I can't support that, but I think there are some good ideas in that plan. And, but at least they came up with something. And I think it's not a bad thing for Republicans to come up with what they think would be good, and then Democrats come up with what they think, and then work together to try and resolve these problems.
But just to be clear, do you think there needs to be a Republican backup plan?
Well, there always needs to be, yeah, I think both, you know, yeah, I would like to see that, because I believe that, you know, to the extent that we're not making headway, we ought to come up with our own plan. On the other hand, we all know that to have this really work, it has to be bipartisan, and we have to work with Democrats as well. And we can, I think it's good to get plans out there, and then you can play off of the plans and gradually narrow down the areas where we can work together. And right now, let me just say this in closing. I see a pretty good spirit of bipartisanship on the two committees in the Senate. In the House, I can't speak for the House, But I've mentioned that I think Speaker Pelosi and others want to come up with a total Democrat plan, and that's something that may fit within their idea of using reconciliation. But I would caution them that that's not an easy thing to do, and it would be far better to work in a bipartisan manner, as we did on CHIP. Now, we didn't do on the CHIP this year, but the CHIP bill that worked amazingly well, that was a bipartisan bill. And they did take a lot of the former CHIP bill, but I think messed it up a little bit with some of the decisions that they did make. Well, I'm going to have to run. And I apologize because I really do enjoy this, and I wish I could spend more time with you, and you'll have to forgive me for...
Well, Senator, we certainly would love to have you come back if you have the opportunity to.
Love to do it.
We're now working to try and schedule Secretary Sebelius. Senator Baucus also will be coming back. Sorry we didn't get to questions from the fringes. And Senator, thank you for being here today.
I apologize to the fringes. I really do. Yeah, look,
Senator, thanks.
You bet. Thanks so much. Good to see you.